Hi, I'm Jackie Salvador, and I'm going to be performing a head-to-toe assessment today. I'm going to wash my hands. Hi, I'm Jackie, and I'm going to be the nurse today performing a physical assessment. Can I have your name and date of birth?
Challenge 12/9/23.
Okay. And can you tell me where we are today?
Living effect.
And why are you here today?
Physical assessment.
Can you tell me the weather outside?
The winter.
Okay. And person is alert and oriented times 4. I'm going to check the range of motion. Can you move your arms? Can you and your wrists? And can you lift one leg at a time? Okay. Can you push up, push out, and pull back, and push up? Okay, good. And you can push down my hand, up, and squeeze my hand. Good. Patient is bilaterally strong and equal in all 4 extremities. Do you have any allergies?
No.
And are you having any pain today?
No.
Okay. We're going to, I'm going to do vital signs. I should have done this before I started any of that. Alright. Her blood pressure was 90/70, which is within normal limits. Take your pulse. And I would take her pulse for a full 30 seconds and then multiply it by 2. And then after those 30 seconds, I would watch for her respiratory rate in normal limit would be 12 to 20. And then alright, 98.6, perfect. Alright, and can I have you come with me so you can take your height and weight?
Yep.
Tell me your full name and date of birth. And the patient is 5'5". And can you tell me what kind of take your waist circumference? So she is alert times 27. And the patient's BMI is 21, which is within normal limits for
Her speech is clear.
her age. And before you sit down, can I have you walk to me, heel toe? Oh. Alright, and can you walk back normally? Okay, and can you walk on your toes, and then your heels? Good, and I notice that the patient's mobility is steady, coordinated, and yeah. Can I have you bend forward and touch your toes? And I notice that the scapulas are bilaterally equal and the spine is midline. And can I have you stand up? And the pelvis is equally aligned. All right, and I'm gonna have you stand with your feet together, your arms by your side, and close your eyes. And I'm testing for her balance, which is the Romberg's test. And she passed the Romberg's test. I can have you take a seat. All right, I'm going to inspect your skin. So it's warm and dry, and I'm going to test your extraocular movements. So can you just keep your head straight and follow the pen with only your eyes? And this is a 6 cardinal sign. Good. And I'm going to test if you're reacting to light. Good. And accommodation and convergence. Good. So patient demonstrates perla, which is pupils are equal, round, reactive to light, accommodation, and convergence. And her extraocular muscles are intact. I'm going to test some of your cranial nerves.
Okay.
Can you smile, frown, spread your cheeks, wrinkle your forehead, shrug your shoulders, stick out your tongue, and move it side to side. Good. All of her cranial nerves are intact. I'm going to inspect the ears, which the top of the ears are aligned with the eyes, which is good. I'm going to palpate the pinnas. I don't feel any bumps or anything. I'm going to pull back the pinna to inspect the tympanic membrane. Good, and there's no signs of drainage or anything. I'm going to inspect your eyes. And I'm just going to pull your conjunctiva down. And the conjunctiva is pink and moist. The sclera is white, and the pupils are round. The iris is round and equal. I'm going to block one nostril and have you breathe out. This is testing the nasal patency. And the other one. And the airway is both clear and showing no signs of a deviated septum. I'm going to, and there's no drainage of the nose, and it's midline. I'm going to have you open your mouth, and the mucous membranes are pink and moist, the gums are pink and moist, the tongue is pink, the lips are pink and moist. Alright. I'm going to have you stick out your tongue and say, ah, ah. And when she says ah, her uvula moves up and back, and her soft palate and hard palate are both intact. I'm going to check for skin turgor. And her skin is elastic, showing no signs of dehydration. I'm going to palpate your lymph nodes, the post-auricular, pre-auricular, submaxillary, and supraclavicular. Good, and I don't feel any lymph nodes, which is good. And now I'm going to move on to respiratory. Okay, I'm going to inspect how you're breathing, and she's breathing easily. She isn't, there's no signs of labored breathing or anything. So now I'm going to palpate. I don't feel any lumps or any tenderness or anything, and I'm going to percuss. Okay, and I'm going to auscultate. Starting at the second intercostal space, so deep breath in through your mouth. I'm just going to go over here. her lungs are clear and no signs of wheezing or anything. I'm going to do the same with the posterior thorax. Alright, so I'm going to palpate, and I don't feel any bumps or anything abnormal. I'm going to concuss. Alright, and I'm going to auscultate. Deep breath in through the mouth. And another. I would start at the second intercostal space, making sure I'm not over any of the scapula. And deep breath. Deep breath. Deep breath. And the lobes. Alright. Lung sounds are bilaterally clear and equal. And can I have you say 99?
99. 99. 99.
Alright, that was testing for tactile affirmatives. And now I'm going to place my hands at T9 and T10 to check for thoracic expansion. Can I have you take a deep breath in? Alright, in which her lungs expanded equally, bilaterally equal. Alright, and now I'm going to have you lay down and we're going to do cardiac valve. I'm going to raise the bed to a good vertical height. Alright, can I have you turn your head back to the side? Alright, and there are no signs of jugular vein distension, which I would be able to see a pulse in her neck. Sorry.
It's okay.
I'm going to check for her pulses. So the temporal, carotid one at a time, brachial, radial. I would check for femoral, popliteal, and I'm going to drop saw, check for the dorsalis pedis and the posterior tibialis. Alright, good. And all her pulses are bilaterally strong and equal. I would check for capillary refill in her toes. She's going to get polished, so it would be better to check them in the fingers. And there's that stuff on. And check out capillary refill. And her capillary refill is good. It's less than 3 seconds in her fingers, which means that she's getting good blood flow to her extremities. And she's not, I don't see any signs of clubbing of the fingers, which is good. And there's no sign of pitting edema. Alright, and now I'm going to auscultate. So first, I'm going to listen to her carotid artery with the bell. Alright, and there are no signs of any bruits in there. I'm going to listen to your heart valves. I'm going to start at the second intercostal space, which is the aortic valve, pulmonic, Erb's point. So we're going to go into here. Tricuspid, mitral, which is at the fifth intercostal space and the mid-clavicular line. And I would also listen for a full minute for the apical pulse, and if I heard any abnormalities, I would have my patient lay on the left side and listen for another full minute. And I'm going to go back through and listen with my bell. To the mitral, tricuspid, Erb's point, pulmonic, aortic. Alright. And everything looks great. Good. Alright, I'm going to do abdominal assessment, and I'm going to have you lay down on your back.
Okay.
Flat. going to inspect first. And there is no sign of distension, any scaphoid. Her belly's flat, which is good. I'm going to auscultate, starting in the right lower quadrant. Listening for 5 to 35 gurgles or clicks in each quadrant, and if I didn't hear any, I would have to listen to a full 5 minutes in each quadrant. Alright, her bowel sounds are active in all 4 quadrants, and now I'm going to percuss. I should have started here. Alright, and I'm going to lightly palpate, check for any tenderness, and now I'm going to palpate deeper for any enlarged organs. And that'll be the end of our assessment today. I'm going to raise your reader down, lower it to the lowest position, raise your reel up. Your call light.
Thank you.
If you need anything, let me know and I'll be right there.
Okay.
Alright?
Yeah.